So here we are at the Colony ER emergency room. Me, the lovely Dr. Holland.
Hello.
So, Plano Moms, here we are as promised. We have our Facebook Live opportunity to chat to Dr. Holland about the flu. So the flu is a huge topic of conversation amongst mums. And if you have any concerns at all, you've woken up in the middle of the night, you felt panic or nervousness because you just don't know what symptoms your kids are having and you don't know what it means, Dr. Holland is going to help reassure all of us. So here we are at the Colony ER Hospital, and we're just going to walk all the way back to the infant room, is that?
Yeah, we have a great looking pediatric suite for the kids, make them at home when they come in.
Great.
But so yeah, we can start walking back and see. The biggest thing this year is that the flu is hitting hard and huge numbers, lots of people with the flu, lots of people with symptoms. To start off with some of the basics, the concept of, getting the flu, symptoms, right? Fever, cough, nasal congestion, runny nose, getting the chills and body aches. These are all symptoms of the flu. Question is, okay, well, does that mean anything for me? Do I need to be worried about that? Do I need to be worried about my kids? For the vast majority of people, no. Young, healthy people get the flu every year, feel miserable, feel bad, and then they get better, right? And that's the natural thing. But I'd say that it's very similar, and I'm not trying to stereotype dogs or anything like this, but this is something that people can relate to. Mm-hmm. If you think about like dogs that have gotten a bad name, right? Rottweiler, pit bull, things like that. We all know cute, cuddly ones, right? That've been great, cuddle up and we just love on them and they're just fine. And then there's others that have gotten the reputation that they rip your face off and there's bad things. The flu can be similar, just the flu can be very benign and that cause you to be miserable, but then you get better. And then there's other times that it can create big problems and can lead to death, okay? And that's where a lot of this fear kind of comes from. From the moms.
Yes.
And I do encourage you guys to ask some specific questions so that I'm not just in here talking to you, but can actually answer the things that you want to know.
That's right. So we've got quite a few mums already online at the moment. So if you're watching us right now, we're at the Colony ER Hospital. This is Dr. Holland, and he has very kindly donated his time to answer all your questions today. And I think the flu has become a real topic of conversation this winter. And I know that a lot of you might be thinking about it or have already experienced some symptoms and do have questions. So please ask those questions right now. This does not cost you a penny. You don't have to leave your sofa if you're watching or if you're in the grocery line. Just ask away and he will answer those for us.
No physician fee either. Look at that deal. We'll come back and I'll let you guys see our little pediatric room and we can see about answering some of y'all's questions.
Yeah.
Okay? Going back to that as far as when do we need to be worried, right? Parents, this is our nice pediatric suite. People can bring their kiddos in here and we treat people of all ages. I'm going to sit with Mr. Tiger here. And
I was wondering if Mr. Tiger has a name.
I let the kids name the tiger because then they get to use their imagination, come up with something, and that makes them feel better too.
Yeah.
Now they got an instant buddy that's in here with them.
So I have 2 questions so far from mums. First of all, hi Sarah, thank you for your comment today and your question. Sarah wants to know, is the flu airborne?
Yes, so this is something that is basically, it's airborne in the sense that it's contact droplet. So when people sneeze, when they cough, they get stuff on their hands and then it's there. Right, and so it's also something that if they have that, it's those little bitty airborne particles that can end up getting in to your respiratory tract, and the virus can spread like that. That is why that we would recommend anyone that does have the flu get kind of quarantined and stay away from everyone else. Okay, so if that means family member, it means not going to work. It means trying to keep people apart from each other. It also means lots of hand washing. Okay, that's one of the best things that you can do to end up preventing the spread of the flu. I would say another tidbit of information, if you have fevers, which one of the things is you do not have to have a fever to have the flu. The vast majority of people do, but it's not 100% that you have to have the fever in order to be diagnosed with the flu. Most people do. If you do have a fever, at least 24 hours after the fever goes away, before you kind of get out into society, go back to work, do these sort of things so that you're not getting everyone else sick. That's a big thing.
That's great, thank you. And another question from Masha. Hi Masha, how are you? Thank you for your questions today. She's got 2 questions relating to Tamiflu.
Mm-hmm.
So how many times can you take the Tamiflu?
I guess that would mean I would want a little more information as to what you're trying to get on that. Now,
so she said, if you get the flu several times, how often can you take it?
I would say that, are you talking about in the same flu season, getting the flu multiple times? Doesn't tend to happen. That is one of those things that the flu, and goes back to getting us into the vaccine and how effective it is and how things change. The flu itself can change, even during the flu season. Even the same strains, they have some drift and they can kind of change and mold a little bit. It is okay that you can take it again. It's not something that's just a one time, once a year, and then you're done. You can take it multiple times. The question starts coming into how effective is it? Is the virus similar, and is it really going to help you out much? But there's not a problem with taking it a second time.
Okay, what about 3rd, 4th, 5th time?
I don't really know if there's really a upper limit on it, but if you're getting the flu, that many times, then I think we have some other issues that we need to be talking to some specialist about at that point.
Okay.
That's not a norm.
Okay. So Elise is asking, hi Elise, she's asking, how long does the typical flu virus affect a person?
That can be variable, and that's one of those things that goes back to that whole, like, talked about the dog Rottweiler analogy. It can affect the same person, same flu virus differently, and every body is different, and that happens with diseases, not just with the flu virus, but anything, just getting a cold. Some people, the same virus just causes the congestion and stuff for me, but can cause a cough and a bronchitis for someone else, and it depends, same thing. It can last anywhere from, just a few days, 2 to 3 days, up to 7 to 10 days.
Okay. So Lee is asking us, how does the flu turn into pneumonia?
So, and I think that's a great question, because that leads into that whole, when we deal with the ones that are getting, more serious and more things you need to worry about. So this is something that for moms with their kids, or even themselves, people have died from the flu. People die from the flu, every year. Again, does it happen to everybody? No. One of the ways that happens is these secondary complications. So something like pneumonia. Pneumonia is when you get an infection that happens in the lung, happens in a big section of the lung. Part of that is the inflammation that occurs. The virus is attacking things. Think about it in an invading army, right? And it's creating havoc and creating problems in that battleground. And then your body's coming in to fight it too. Well, that creates a lot of havoc, a lot of inflammation. That's what leads to the body aches and these other symptoms that we have. When it concentrates in an area, or when your defenses are down because they're so spread out and doing all these things, now we get set up for bacteria, different than the virus, comes on top and basically kicks you when you're down, and you end up getting a pneumonia at that point. That's when people will start having increased cough, difficulty breathing, running the higher fevers, start looking more ill too. Those are all great reasons you need to come to an emergency room and get checked out.
That's right. So if you've just tuned in, mums, we are here at the Colony ER emergency room, and this is Dr. Holland, and he is really kindly offering his answers to your questions today, because we know that right now the flu season is a concern for many of us, right? So this is your opportunity to ask your questions, so please go ahead and do so. The Colony ER is one of the best local resources for you, and I do invite you to go to their Facebook page and go and like, so that you can get much more interesting, useful information and content as well. So we have another question. This is also from Lee. She's asking, how effective is elderberry syrup and gummies?
That's one of those things I would honestly be making up an answer to. Can it help? Yes. Can I put a number on it? No. There's so many things that we just really don't understand. I mean, we thought we knew the body, 50 years ago, and now we kind of laugh at some of the things that we thought. To me, a lot of medicine is similar. There's only so much that we know. We hadn't gotten to those Star Trek days where we can kind of wave the wand across you and go, oh yeah, that's exactly what's going on. We're still figuring things out about the body. We're also still figuring things out about what really works and how does it work. But if it's found that there are some things, whether it's supplements or alternative medicine, I'm definitely not opposed to the concept that there are things that you can take that can help you. I can't, however, put a number on it. You know, it's one of those things. I do not think it's going to hurt you to take it, and it may help. It's worth a try. And
actually, Brittany asked that question too. She's asking about the holistic stuff. You know, what can mums do at home to try and manage this in their own household and try and protect their kids? You know, I think a lot of them are looking at other things that they can do themselves.
No, and I think that's very smart, and that's showing a sign of being a good mom, is looking to see what resources you have and can do. I will not pretend to be an expert in holistic medicine. I'm not. But it is one of those things that, again, if we find some stuff that is recommended and that, you know, tends to work, there's usually no problem in trying it. One of the only caveats that I say on some of the things when we talk about holistic medicine or buying some of the things that are not FDA approved is there have been plenty of studies showing taking a bottle of this and a bottle of that, same medicine, same, you know, brand name, etc., looking at individual pills, and the content in the pills varies drastically in the ingredients from one pill to the other. That's one of the biggest concerns I have with using some of those things. But again, it's not that the concept is bad, and there's some of them that work great. You just have to be a little bit more cautious with things that are not FDA approved, just from that aspect.
Absolutely. So I have another question from Marina. It's sort of similar. She's asking, is giving lemon and honey water along with vitamins, can that help?
Yeah, and that's one of those things that's always a soothing thing. I think anytime we're giving any kind of vitamins or supplements from that side, you know, a multivitamin a day is definitely a great idea. You know, how many of us can really say that we get a, you know, full 100% balanced diet and getting all of our nutrients and all the things that we recommend every single day? Not many of us honestly can do that and say that we do that consistently. So those kind of things can always help out. Anything that you're given that your body naturally has can help out with fighting the flu.
That's great. So Sarah actually, she's shared something really interesting on the thread. So thank you for that, Sarah. She's saying she's having an internal struggle at the moment on whether to allow her 1-year-old to go to play dates or even out of the house. She said all the media hype on the flu is really concerning her. She said that she's the crazy mom chasing her toddler around with antibacterial hand wipes.
Yeah.
So we
all know them.
Yeah, she's asking, how do I personally keep from catching illnesses from patients? And we have had conversations actually about, you know, when mums have taken their kids to a doctor's office or somewhere, you know, an urgent care or emergency room like this one, and other people around them are showing symptoms, and it's very scary.
Correct. So that goes back to the contact, you know, the way that this flu spreads. Do I think you need to, you know, halt all, you know, activity outside the house and all communication with the outside world? No, this is flu season. It's not apocalypse at this point. So this is one of those things that, you know, some things within reason. Now, obviously, screening whether or not the other family has had contact with anyone with the flu, you know, having any symptoms, then yeah, maybe that play date can wait for a little bit of time. Antibacterial, you know, and these hand sanitizers that we have, that we kind of do every time we walk in and out of a room, you know, and doing this is how I remain, you know, not getting sick. I come in contact with people with the flu every single day, right? We currently have, I think, 2 or 3 patients right now with the flu that are here getting treated, and they're starting to feel better with that. But these are the things that you can, you know, do. And it sounds like you're already doing those things to help yourselves out. But no, don't quarantine yourself away from society just because it's flu season.
That's right. And Debbie says, it helps that we've got elderberries at our disposal. So I've got another question here. This is from Silaja. I hope I pronounced your name right. I'm sorry if I haven't. She's asking, is it a good idea to get a flu shot now? Does it work for this season?
So that actually is a great question and brings a whole host of things that I could spend a long time just talking about that. To try to kind of keep it short, you know, with you, yes, you can still get a flu shot. Yes, it still can help. In general, the flu shot is something that's like 40 to 60% effective against preventing the flu. Doesn't sound like necessarily a lot, but when you consider the overall numbers of the people that, you know, when you're taking in the entire population, that's a lot of people that can be prevented from getting the flu. I think this season was a little bit more of a miss, so I think that rate is going to be lower. The 10% rate has been thrown out a lot, but apparently that was just from some Australian study on their effectiveness, but not necessarily confirmed here. But it is still lower than the 40 to 60%, which is why we're seeing, such a rampant, flu season this year.
So Brittany actually asked that question too, but she said, is the end of February the end of the flu season, but the worst month?
So there are, technicalities, and people can, come up with a specific date, just like, we talk about the first day of winter, right? And the last day of winter. Does it mean that it's not cold beforehand, or that it's, stops and all of a sudden becomes warm afterwards? No. So we actually see flu all year round. We'll see cases, that occur. And that's one of the ways that the scientists are trying to figure out ways to, target the next vaccine, to figure out how things are changing. What are we going to do to make this next season even better, is because of that. So yes, when you start getting into January, February, that does tend to be the worst month. I would not say that I would call any date the end of flu season, even though there technically is one if you look it up.
That's great, thank you. So Christina's asking, she said, I'm flying to California. What precautions can I take on the plane without getting carried out by TSA?
That's a great question. Honestly, there are some masks that you can wear, and then the hand washing and being careful on what you're taking. Even take some little sanitary, wipes and some antibacterial, antiviral, disposable pads. Wipe down your, the tray, wipe down the armrests and things that you're with, things that you're going to be in contact with when you're on the plane. If you want to get to the point of wearing a mask, obviously that does protect you from the droplets and provide you an extra level of protection. Yes, you may get looks, from people thinking that you're the one carrying it, which you'll have to explain a few times. But that is the, if you're going to try to be cautious, that's the way to do it.
That's great. So if you're just tuning in now, we are just talking to Dr. Holland about the flu, a big topic of conversation. This is your chance to ask questions. I think we can probably take one or two more questions, and then you can get some reassurance and some advice that might be helpful for you. So Carrie says, my 9-year-old had the flu before Christmas and no one else got it. How likely is it that the rest of our family will get the flu now weeks later?
It's actually, Carrie, appreciate the question. It is something that is a lot less likely. That's one of those things that tends to be within a week or so, a week to 10 days is going to be when you're going to see the effects on another family member. Can it happen later on? Sure. Is it a direct response from the 9-year-old? Probably not. Somebody else is getting it from somewhere else. I did want to say, since if we're running any short on time, the concept going back to who's at risk for the complications, who needs to be coming to our emergency room or emergency room near you. Kids, especially less than 5, okay, especially less than 2, are at higher risk for complications from the flu and really need to be started on some antiviral medications. The elderly, over 65, anyone that has medical problems, chronic medical problems. Unfortunately, that's a big list that I'm not going to go through, but it's one of those that any of those kind of things will make you at higher risk for developing those complications, like we talked about, the pneumonia, getting ear infections, bacterial infections that come on top of the flu itself. The main way that people actually die of the flu, it's rarely the flu itself that's doing it. It's all the complications. You start getting these multiple things, and then the inflammation, it gets a little more aggressive, and now it's happening to different organs in your body. The organs shut down, multi-organ failure, leading into death. That's how that occurs. It's not just the flu itself, and so that's why it's important. Any sign that things are getting worse, we're feeling worse, we're having trouble breathing, anything like that, need to come into the emergency room and get seen.
And of course you're open 24/7, so a lot of times we notice as mums that it's actually when our general doctor's office is closed.
Correct.
And it's in the middle of the night, or it's at the weekend, and we are panicking, or we're trying to contact our general doctor or pediatrician, and we're just not able to get our child seen as quickly as we would like, because we want them seen as straight away. This is this is the reason why you would come to an ER, and the Colony ER is obviously a great option. I've got just a couple more questions. Sure. Then. First of all, Tricia, she's asking just about the mask that you mentioned earlier.
Yeah.
So, especially if you're traveling, you're on a plane. She said, can you still get the flu from droplets to your eyes?
Yes, anything that's a mucous membrane, you can. but it starts becoming a little unrealistic to walk around in a hazmat suit. You know, it's one of those things that tends to be something not that's just kind of floating in the air and you kind of walk through. That's literally someone that's going to come up and bet you know, and be in your face with that and get this. Then yes, that is a potential way that you can get it.
Okay. So Alina says, I didn't get a flu shot last year and I got the flu in March. And then she got the flu shot in September and she still got the flu in November. Am I still at risk for getting it again?
Well, going with your luck streak there, I'm saying that you're probably at a higher risk for getting it. That's just bad luck. It doesn't necessarily mean that you're at high risk. If you already got the flu shot, you have the flu, then unless the strain changes significantly, your body should have the immune system built up to prevent you from getting it again.
That's awesome. So as we wrap up, I just want to give you a final opportunity, Dr. Holland, to share anything with mums that you think they really need to know about. And also just to let you know, if you're watching, we know that you can't always catch this live. If you're watching this on replay, please take the time to post your question or post comment and ask anything you want to, because Dr. Holland and his team are going to be following this post on Plano Mums anyway for the next few days, and they will definitely be answering those questions for you. So even if you're watching on replay, please take the time and do ask that question. I've got a few more questions really quick. I'm going to throw them in while we have the time.
Let's go for it.
Okay, Brittany says, my sister is having her baby next week. Her sister's worried about people visiting the baby. Should everyone wear a mask even if they haven't been sick?
That honestly, during this time of season, is probably not a bad idea. I would limit contact, especially on a newborn, with anybody, especially everyone that wants to come up and touch the baby and hold the baby, stroke the baby, these kind of things, that you need to be a little bit more cautious. And I think everybody can realize that that's an important thing on a newborn. Okay.
So I've got two more questions and then we will have to just close off the live video for today. But first of all, we've got Bezawada, and she says her 4-year-old son had flu in November and again in December. Is there a chance he might get it again? If so, what are the precautions do I need to take? And Silaja is asking, what are the early symptoms of flu?
So two things. One, that's similar to the previous question, that yes, it always is possible. If you've already had it twice, or if he's already had it twice, definitely a lot less likely that we're going to get it again. Does that mean that we can't get other signs of or other infections? No, obviously anything is game, especially in the winter when everybody gets huddled together with each other and there's more contact among people. That's why we start seeing some infection rates going up in general, regardless of just the flu. The other question was
about the early symptoms of flu
symptoms
in kids.
In kids, the similar type things. So basically, you'll start noticing some fatigue. They're not quite themselves. They're going to start running potentially some fevers, having some congestion, having cough. Talk about just not quite feeling right, or their descriptions of kind of body aches. And again, that's one of those things that Abby talked about is, that we're here 24/7. My wife may not be happy about that, but it comes in handy when it's talking about taking care of the patients. When your doctor's office is closed and you're having these kind of symptoms, your kids are getting worse and you're concerned about it, we're here to help.
That's right. So final question, and then we'll close it off for the live video. But again, if you're watching this on replay, please post your questions, because we will be getting answers for you to those questions. So Gulala asks, what else do you recommend beside the flu shot?
In order to prevent the flu, I think we're just kind of doing the same thing. It's one of those that trying to avoid being next to people that are sick. Being careful with the hand washing. Those are the biggest things that you can do. Obviously, anytime we can say eating a healthy diet, maintaining a healthy lifestyle, getting some exercise, all those kind of things put your body in a better position to fight off things to begin with. And if you do get the flu, then it's going to be a little less severe for you.
Awesome. Thank you so much, Dr. Holland.
Yeah,
we really
no problem
appreciate your time. And it's been a pleasure to come here to the ER here, the Colony ER. Please consider it as an option, because it's open 24/7. It's just right here on the 121, so it is accessible for many of us. And of course, now you've met Dr. Holland, and it's great to meet him in person and see. He's such a nice guy. He's a father of 2 sons.
That's right, 2 boys, 5 and 9-year-old, Tyler and Logan.
5 and 9. So he is very, very, very conscious of all of the concerns that we have. The mums are very grateful. They're all saying thank you so much. They really
thank you guys for tuning in.
So have a wonderful day, everybody, and we will catch you all soon.